You cannot start your video. No. Dr. Nirbai? Hmm. A very good evening to all the students who are attending this live session. I am Dr. Arun, Faculty of Community Medicine for the team Nextillo. I'll be handling all your community medicine sessions. At this juncture, I take the opportunity to thank Nextillo, Dr. Sunil Sharma sir, who is the founder of Nextillo, and all the co-founders for having given this opportunity, and also at the same time for providing the students this live session classes and with the best educators in Nextillo. So with this, we will be starting the session. It will be a very interesting session. I have chosen such a topic that is very important, not only from the exam point of view, but also whenever you practice in any branch, this topic is going to help you. And it is also one of the most frequently asked and a repeated topic in the examinations. Having some issues in change. So today we'll be talking about biomedical waste management, and I am having some technical issues in my system. I'll get back with the PPT in a while. So I hope So this is the link for the class today. I'll be taking the live session on community medicine, and my name is Dr. Arun Padmanandan. And today I'll be talking about biomedical waste management, which is a very important topic. Biomedical waste. Biomedical waste means any waste which is generated during the diagnosis, treatment, or immunization of human beings or animals or research activities pertaining thereto or in the production or testing or in health camp. So very important point here is the word immunization has been added. So keep in mind that immunization has been added, and also the point that research activities has also been added in the latest definition. Most important point is the rules for biomedical and waste management was amended in the year 2016 and also again in 2019. So from 2016, we are following new rules for biomedical waste management. That is one thing. Second thing, the biomedical waste management, the policies are framed by Ministry of Environment and Forest. So that is an MCQ question which you can get in the exam. It is not by the Ministry of Health and Family Welfare. Biomedical waste management guidelines are framed by Ministry of Environment and Forest. The most important characteristic or the most important feature in biomedical waste management will be the segregation of waste. So segregation forms the mainstay of biomedical waste management. It ensures that the quantity of waste which is generated from that particular site needs special attention, and it is considerably reduced and better managed. So different types of waste need different treatment because you generate different types of waste from the hospital. So from each patient you have different types of waste, and each waste will need different treatment and segregation. And the segregated waste must be properly labeled with date, time, and site of generation. So now in the last schedules and the last previous guidelines, when I was studying MBBS, we had 10 categories of biomedical waste, but now we have only 4 categories: yellow, red, blue, and white. So what all waste goes into the yellow category? First is human anatomical waste. Human anatomical waste includes human tissues. It can be after the surgeries or whatever pathological tissues, organs, body parts like amputated toe or amputated limb. So they can ask in the exam, a patient with diabetes presented to the ortho department or the surgery department with dry gangrene or wet gangrene. The surgeon examined the limb and decided that the foot or the toe has to be amputated. After amputation, the amputated toe will go into which category? So they will ask yellow, red, blue, and white. So the answer will be yellow. And fetus, dead born fetus. Then you have animal anatomical waste. Any waste which is generated from the animal lab or the research purposes. Animals used for research purposes like preclinical studies. Some animals might die. So, or maybe you do a surgery in the animal and take out some body parts of those animals. Those all waste go into yellow category. Third is soiled waste. It is not solid waste, it is soiled waste. Soiled means contaminated with any fluid. So items contaminated with blood, body fluid, like what are all the common things which are contaminated with body fluid? Like you have the cotton swab, you have the plaster cast, you have gauze pieces, all the dressings. Those are all soiled waste. Those goes into the yellow category. Then you have expired or discarded medicine, including antibiotics. Okay. So previously when we were studying MBBS, we used to learn that expired medicines used to go in black bag. But now the guidelines have changed. the expired medicines or the old medicines which has to be discarded will be discarded into the yellow bag. So expired medicines will be discarded into yellow bag. Then you have chemical waste like the discarded disinfectants which will go into yellow bag. You also have liquid chemical waste. Liquid chemical waste means the waste of the chemicals from the floor washings also has to go into the yellow, but the point here is they have to be pre-treated and they have to go into a separate drain and then go into the effluent system. So that is for liquid chemical waste. Then you have discarded linen. You have discarded linen, mattress, beddings which are contaminated with blood and body fluids, your mask and gown all go into yellow bag. Question was asked in 2021 NEET exam. If a intern working in a COVID ward was using a routine surgical mask, after her duty, she threw the mask into the red bin. Is it correct or wrong? That is what the question asks. The question may not be exactly, the words may not be the same what I have said to you, but this was the scenario which was given. And whether it was right, it was wrong, or some other options were there. So that answer was a wrong answer because mask has to go into the yellow bag and not into the red category. Okay. Then you have microbiology and biotechnological waste, lab cultures, culture specimen, vaccine waste all go into yellow bag. Very important, blood bag. Blood bag is red in color because it has blood in it. You see it is red in color. Don't think it will go into the red bag. Blood bag will go into yellow bag. Then cytotoxic drugs. Your cancer drugs or chemotherapeutic agents will also go into yellow bag with a separate label on it called as C. Okay. So these are all things which go into the yellow category. Now we have the second category, which is red. Very important, frequently asked questions from this red category. Red starts with R. So red is all the recyclable waste will go into red category. Contaminated waste or the recyclable waste generated from disposable items such as tubings, bottles, intravenous tube like IV set, your Foley's catheter, okay, your rice tube, your urine bag, Euroflow meter, okay. Then the gloves which you use, then syringes. Syringe without needle will go into the red bag, okay. So all your contaminated waste, like which are recyclable, like your tubings, catheters, IV set, central venous catheter, Foley's catheter, Riles tube, Eurometer, syringe without needle, your vacutainer from the labs, and also gloves will go into red bag. So your surgical gloves, your examination gloves will go into red bag. Then you have the white category, which is a translucent container which is mainly for sharp waste. Okay, so what is a sharp waste? With anything which can cut and produce infection or bleeding. Okay, so sharp waste including metals will go into the white container. What are all the waste which will go into the white category? One is needle because it is sharp, syringe with fixed needles, these are called as AD syringes, that will also go into the whole set after the injection will go into the white, but the syringe alone without needle will go into the red bag. Syringes with fixed needles will go into the white container. Then scalpel, blade, or any other contaminated sharp objects that may cause puncture and cut will go into the white container. Then the last is the blue category. So the blue category is only for two things. It is for glassware and metallic body implant. Now, what is this glassware? Broken or discarded contaminated glass vials, vial and ampules of the medicines after usage will go into the blue cardboard box, except those contaminated with cytotoxic waste. We have already seen cytotoxic waste is a separate category. It goes into the yellow bag. So an MCQ was asked again, I think AIMS 2018. They asked a very good MCQ. In an ophthalmology ward, a patient was admitted with retinoblastoma. The postgraduate resident who was posted on duty was supposed to give bevacizumab. Bevacizumab is an anti-VEGF inhibitor. So it is a anti-cancer drug. So after giving bevacizumab, the intern has to discard the vial in which category of waste. So yellow, red, blue, and white were given. So everybody thought it is a broken ampule, so it has to go into blue. The answer was wrong. It has to go into yellow. So vials contaminated vials of cytotoxic drugs will go into yellow category. Others will go into blue. At the same time, metallic body implants will also go into blue category. Okay, so this is like a revision for you, this slide. Yellow category, we already seen human anatomical waste, animal anatomical waste, soiled waste, okay, all your cotton, dressing, plaster cast, gauze, linen, mattress, beddings which are contaminated with blood, okay. Then your mask, your gowns, okay, patient diapers, infected plasters, microbiology and biotechnology waste, discarded medicines and cytotoxic drugs, solid chemical waste, and blood bag. So blood bag goes into yellow category. Please remember that. Then you have the red category, which includes all your recyclable waste, syringes without needle, gloves, plastic tube, your cannulas, then IV sets, plastic bottles, plastic gown, okay, nasogastric tube, catheter, urine bag, blood transfusion set, vacutainers, all these go into red category. In white is for sharp. So this is the white container which you can see here. It is only for sharp, needle, scalpel blades, scissors, lancet, syringe with fixed needles. Not always insulin syringe. Syringes with fixed needles are usually used in immunization campaigns. So for immunization, we use a AD syringes. Then you have contaminated metal sharp. Blue category, we have already seen vials, ampules, except cytotoxic drugs, broken and discarded and contaminated glass, and metallic body implant. So just going through it again. So this is yellow category waste. This is red category waste. This is white, blue. Okay. So once you have segregated this waste, how will you dispose the waste? That is very, very important. You should know how to dispose these waste and how these waste are disposed. So you now know what all waste come into the yellow bag, what all waste come into the red bag, white and blue. So yellow bag, finally the bag, the entire waste is disposed of by incineration or plasma pyrolysis. Basically, what do you mean by incineration? Incineration is basically a high temperature. It's a dry oxidation process where your waste is reduced in volume and weight. The only disadvantage with incineration is it produces smoke and it can contaminate the environment. What is the temperature used in incinerators? It is 1200 degrees Celsius. Okay. Then you have red bag, which is recyclable waste or contaminated wastes. The bag will be disposed of by autoclaving. You know what is autoclaving? You would have read in microbiology, or microwaving, or hydroclaving. After that, it will be shredded and mutilated. That treated waste will be sent to registered or authorized recyclers and it will be recycled. Okay, so that is why the recyclable waste will go into the red bag. Then you have white, which is sharp waste, again autoclaving or dry heat sterilization, followed by shredding and mutilation. The blue again is disposed of by autoclave, microwave, or hydroclave. Okay. So how to remember this? Yellow, remember incineration, rest everything autoclave or microwave or hydroclaving. Okay. So for COVID-19, they had used a separate protocol. Okay. So for COVID, they had used a separate protocol. Not much of difference, only slight changes were made. Instead of a single layer bag, COVID-19 wastes were disposed and segregated using double layered bags. So instead of using one yellow, one red, one blue, they will be using two double layered. Okay, it should, so double layered bags were used for collecting waste from COVID-19 isolation ward so that there is no leakage. So that is why to prevent leakage, they were using double layered bag. Before handing over the waste to the particular waste management authority, they have to collect and store these waste separately from other waste. They cannot mix both the routine hospital waste and the COVID-19 waste. They used a dedicated collection bin labeled as COVID-19 bin to store these waste and keep them separately. In addition to mandatory labeling, bags and containers used for collecting biomedical waste from COVID-19 wards should be labeled as COVID-19 waste. So everything was labeled properly and guidelines were made. Okay. I have already told you the guidelines for waste management will be framed by Ministry of Environment and Forest and not by Ministry of Health and Family Welfare. COVID-19 waste, they maintained a separate record of waste generated from COVID-19 isolation ward, and they used dedicated trolleys and collection bin in COVID-19 isolation ward. A label COVID-19 waste was also pasted on these items. The inner surface and the outer surface of the containers used for storage of COVID-19 waste should be disinfected with 1% sodium hypochlorite solution daily. Okay, so the disinfectant used was 1% sodium hypochlorite. Okay, so how and what all things were segregated in each category? So the triple layer mask, N95 mask, the head cover, the head cap, the shoe cover, the disposable linen gown, disposable plates, glass, used tissues, everything which are used by the COVID-19 patient, glass, non-plastic or semi-plastic, went in yellow bag. Okay, went in yellow bag. Goggles, face shield, splash-proof apron, hazmat suit, nitrile gloves, and the plastic bottles and all the IV tubings and sets went into the red bag. So it is same like that, but little bit of changes. Don't get confused by this. Go with the routine guidelines. This slide was put just to give an update about the policies can change in case of an outbreak, but stick to the original guidelines: yellow, red, white, and blue. So this is an helping hand plan by Nextillo. They would like to walk with every medical student during this unexpected times around the world. It is an exclusive offer for FMG students. They can get a complete access to Nextillo app for 3 months at just 89 rupees. So they can install the app now and choose the helping hand plan. Okay. So this offer is for a limited period of time. So please download the app and avail the benefits. So now we'll go to the question answer sessions. So the first question, I hope everybody is able to see it. I'll just minimize my screen. Following blood transfusion, blood bags are disposed in which color bag? So nowadays questions will not be directly asked like this. It will be a scenario based question. So how will you convert this into a scenario based question? A patient posted for surgery, let us say any surgery, let us take open reduction and internal fixation of proximal humerus. So that patient was posted for a proximal humerus fracture patient was posted for open reduction and internal fixation. The day prior, 1 minute, I'm sorry. The day prior to the surgery, the anesthetist found out that the hemoglobin for the patient was 9 grams. Okay. So they decided to transfuse the patient with 1 PRBC. So the intern posted in the ward was transfusing the blood. After transfusion, the blood bag will be disposed in which category? So that will be the scenario based question. So now you know the answer. Blood bag will be disposed in yellow category. Okay. There is nothing to think about it. We have already discussed. Blood bags will be disposed in yellow category. According to the biomedical waste management guidelines of 2016, the material for incineration, should be discarded in which color bag? Now we have already seen how to dispose the waste. There are many methods of disposal: incineration, plasma pyrolysis, autoclave, microwave, and hydroclave. You know which waste is now incinerated? Yes, the correct answer is yellow. We have already seen that yellow bag will be disposed of by incineration or plasma pyrolysis. Which of the following is discarded in red bag? Okay. Which of the following is discarded in red bag? Needle, animal tissue, glass vial, plastic waste. Now you can rule out the answers from this. R is for R, recyclable waste. Needle, we already know, is a sharp waste which will go into white. Animal tissues, we know it is an animal anatomical waste. It will go into yellow bag. Glass vials and broken ampules will go into blue. So answer would be plastic or the recyclable waste or the IV tubing. Question number 4. What does this picture represent? Cytotoxic, biohazard, radiation hazard, and bioterrorism. Picture-based questions can come in your exam. So this is an image showing biohazard. Again, what does this picture represent? Cytotoxic, biohazard, radiation hazard, and bioterrorism. So this is a radiation hazard diagram. Okay? Radiation hazard diagram. This diagram will be in front of all your MRI, CT and X-ray rooms. The radiation hazard symbol will be there. You would have already seen those things. So now I'll brush upon another. Okay, before that we have question of the day. So you can start typing your answers. Fetus less than the period of viability was delivered from the labor ward. So it was delivered. Obviously, if it is less than the period of viability, it has no signs of life. So it is dead fetus. After that, it is to be supposed to be discarded in which bag? Now you know where human anatomical waste will go, where animal anatomical waste will go. Okay. So the answer is straightforward. It is yellow. Okay. Actually, the question of the day should come to the students, but I myself have given the answer. It's okay. Okay. So all the students are the winners today. Fetus less than the period of viability is supposed to be discarded in yellow bag. Okay. So this is the last important topic which I will be touching today. These two important topics frequently repeated in your exam. National immunization schedule and biomedical waste management. Without studying, if you go to the exam, these two topics, I am sure you'll miss 5 MCQs, 2 to 5 MCQs, because commonly asked. So first we'll see the immunization given in pregnant women. So we already know the vaccine which is given for pregnancy is TT, but it is now no more TT. It is TD, tetanus and diphtheria together are given. Okay. So the first dose is given as early in the pregnancy. It is given 0.5 ml intramuscular in the deltoid region. The second dose is given 4 weeks after the first dose. And if the woman gets pregnant again within 3 years, you have to give only the booster dose. Otherwise, you have to repeat the full schedule. Okay. So the first dose, when we were studying, it used to be 20 and 24 weeks, but now it is no more like that. Whenever, as early in the pregnancy, give the first dose of TD, and 4 weeks after that, give the second dose of TD, and the booster dose if she gets pregnant again within 3 years. Now, what are all the vaccines which are given at birth? At birth, you give 3 important vaccines. One is BCG, hepatitis B birth dose, and OPV 0 dose. BCG stands for Bacilli calmette guerin. It is given at birth. The strain used for preparing this vaccine is Danish 1331 strain. The dose is 0.05 ml up to 1 month, and above 1 month it is 0.1 ml. Remember, it can be given up to 1 year of age. Okay. And what is the diluent used here? It is sodium chloride, and it is given intradermal. So it is given intradermal. Then you have hepatitis B birth dose. It is given 0.5 ml intramuscular on the anterolateral side of mid thigh, left side. OPV is a oral vaccine, oral polio vaccine. It is given 2 drops orally. Okay. So BCG, hepatitis B birth dose, and OPV 0 dose. All 3 are given at birth. At 6, 10, and 14 weeks, you give again OPV. The question is, what is the type of OPV which is used in the national immunization schedule? There are 3 types of OPV: monovalent OPV, bivalent OPV, and trivalent OPV. Now we are using only bivalent OPV, BOPV, okay, which has got type 1 and type 3 strain and not type 2. So it is given at 6, 10, and 14 weeks, 2 drops orally. Along with it, what other vaccines are given at 6, 10, 14? You also give pentavalent vaccine. Penta means 5. So you have 5 vaccine against 5 different antigens. So diphtheria, pertussis, tetanus, hepatitis B, and H influenza. I'm sorry for the trouble. Let's see. Because I'm taking the class from my home, I'm having some trouble here. The vaccine which are given at 6, 10, 14 are OPV and pentavalent vaccine. Pentavalent vaccine contains 5 different, penta means 5. So it protects against diphtheria, pertussis, tetanus, hepatitis B, and H influenza B. It is given 0.5 ml anterolateral thigh on left side. Okay, anterolateral thigh left side. You also have fractional IPV. Fractional IPV is given at 6 and 14 weeks. IPV stands for inactivated polio vaccine. It is given 0.1 ml intradermal. Okay, it is given 0.1 ml intradermal. It is given in the upper arm. So two vaccines are given intradermal. One is BCG, which is given in the left arm. Second is fractionated IPV, which is given 0.1 ml on the right arm. Then you give rotavirus vaccine also at 6, 10 and 14 weeks. The dose is 5 drop. And the last vaccine is PCV, which is pneumococcal conjugate vaccine, which is given at 6 weeks and 14 weeks. And the booster is given at 9 months. Okay. Again, it is given 0.5 ml intramuscular, anterolateral thigh, right side. Okay. So certain vaccines are given anterolateral thigh left, anterolateral thigh right. Don't get confused. Just remember which all vaccines are given intramuscular, which all vaccines are given subcutaneous, which all vaccines are given intradermal. So 6, 10, 14 vaccines given are OPV, pentavalent vaccine, pneumococcal conjugate vaccine at 6 and 14 weeks, rotavirus vaccine 6, 10 and 14, and then you have fractionated IPV at 6 and 14 weeks. Then you have the measles rubella vaccine, MR vaccine. MR vaccine is also given at 9 months of age. Okay, and the dose is 0.5 ml. It is given subcutaneously. What is the diluent used here? It is sterile water or the distilled water. Okay, the diluent used for BCG is normal saline, whereas diluent used for measles rubella vaccine is sterile water. So what are the strains used for preparing the measles vaccine? There are 3 strains. I have discussed all this in the Nextillo lecture series of community medicine. So whenever you subscribe that, you can get access to that. But still, I'll just explain it. Measles, the strains used are Edmonston Zagreb strain, Schwartz strain, and Moraton strain. The commonly used strain is Edmonston Zagreb strain. For rubella, we use RA27/3 strain. Okay, strains are very important. They are commonly asked in exam. Then at 9 months, we also use one more vaccine that is called Japanese encephalitis vaccine. Again, it is given at 9 months, 0.5 ml subcutaneous. So two vaccines subcutaneous, MR vaccine and JE vaccine. So JE vaccine, the diluent used is phosphate buffer solution. So phosphate buffer solution. What is the strain used for preparing the JE vaccine? It is SA14142. So that is a strain in India which is used. You also have Nakayama strain and other strains. But remember, SA14142 is a strain used for Japanese encephalitis vaccine. Vitamin A is a supplement. It is not a vaccine. It is given at 9 months. It is given 1 lakh international units, and then up to 5 years of age it is given. Okay, so the dose is 1 ml. Then 16 to 24 months you give all the booster doses. The first booster dose is DPT booster. You know now DPT is given intramuscular 0.5 ml. MR vaccine is given booster dose 0.5 ml. OPV is given booster dose 2 drops orally. JE vaccine again booster dose 0.5 ml. Okay, and then vitamin A up to 5 years. See, vitamin A 9th month you give 1 ml, which is equivalent to 1 lakh, and then subsequently every 6 months you have to give vitamin A up to 5 years of age. The subsequent doses is 2 ml, which is 2 lakh international units. The last booster is DPT booster, second dose, which is given at 5 years of age. Okay, and TT is given at 10 and 16 years. Okay, so this completes the immunization schedule. Very important. At birth, BCG, OPV 0 dose, and hepatitis B birth dose. 6 and 14 you have OPV 1, 2, 3, pentavalent 1, 2, 3, rotavirus 1, 2, 3 at 6 and 14, fractionated IPV at 6 and 14, pneumococcal conjugate vaccine at 6 and 14. Then you have at 9 months, you give MR vaccine, JE vaccine. JE vaccine you give only in endemic areas of Japanese encephalitis, not in all areas. Okay. And you also give vitamin A 9th month along with measles, 1 lakh international unit. Then every 6 months up to 5 years, 2 lakh international unit. Then 16 to 24 months, you give DPT booster, OPV booster, MR second dose, and JE second dose in case of endemic areas. The second DPT booster is given at 5 years of age. Pregnancy, remember, it is no more TT, it is TD, tetanus and diphtheria. Okay, so what are all vaccines which are given orally? Polio is given orally, which is oral polio vaccine. Then rotavirus is given orally. Then the other supplement which is given is vitamin A. Which are the vaccines which are given subcutaneously? Measles and JE vaccine. Others are all given intramuscular. BCG and fractionated IPV are given intradermal. Okay, so this much you should know. The strain used for BCG is Danish 1331 strain. The strain used for polio is P1, P2, P3 strain. In India, we are currently using bivalent OPV, which is P1 and P3. Then you have measles. The strain used for measles is Edmonston Zagreb strain, Schwartz strain, Moraton strain. Commonly used is Edmonston Zagreb strain. For rubella, you have RA27/3 strain. JE vaccine, 3 strains are used: SA1414-2, Nakayama strain, Beijing strain, but in India we are using SA1414-2. Okay. So this completes the immunization schedule as well. So we have completed 2 important topics today. One is biomedical waste management. Second is national immunization schedule. Very important topics in community medicine. Okay. So with this, I think we can close the session. And though it is a short session, but very important from exam point of view. Okay. So thank you and have a good day.